I chose to practice medicine because since I was a child, that was my passion, to be able to help people. And I believe that practicing medicine, you help the people when they are sick, when they are in pain, and that's one of the things that I love about medicine. So, the ability to be able to communicate with the people, to understand them, and try to help them in any ways to make them feel better and to get their health improved. That's why I chose medicine. The most rewarding aspect about being a doctor is the outcome. Obviously, when it's a good outcome, that is very rewarding. There is nothing better to hear from one of your patients as saying, I am feeling better. Patients are always in need of something, in need of psychological advice, in need of medication for their health, and to be able to help them in that way and to hear that their hypertension is better, the diabetes is getting better, that is very rewarding for a physician. I chose to practice in St. Charles County, especially because I am from St. Charles. Before I went to residency, I lived in St. Charles. Obviously, I came from Ecuador to the United States, but when I moved to St. Louis, then I married here, and we got a house in St. Charles. So I like the area. I never thought about moving anywhere else. And when I finished residency, I decided to come back to St. Charles. I like to serve the community. I like to serve the people in the St. Charles area or Fallon area, and that's why I came back to this area, because I just love to live here. For me, the best tip that I can say to the people is, especially nowadays with technology, is educate yourself. Once you can change the way that you see things, you can change in your mind the way that you eat. For you to eat a healthy diet, it's the same. For diabetic people, you have to learn how to count your carbohydrates. You have to learn how you have to eat. But the same way in hypertension, that if you have to eat less salt, you have to learn how you do those things, and how do you see what food is healthy and what food is not healthy. If you learn that and you change your behavior, that's what is usually going to change your lifestyle. It's about behavior. How do you know what is good for you? I think diabetes is one of the biggest risk factors for several conditions like neuropathy, even heart disease and renal failure. So for me, educating people about diabetes is one of the areas that I feel more passionate about it. If you educate them in every visit, usually the outcome is going to be better. People in my family have diabetes, and I guess there's something personal to me also to be able to help my patients, because I feel like helping them, I am also helping my family in a way that this is what you need to do, and learning more about diabetes is what I like.